This year I talked about implementation of healthcare reform and why and how that has happened, and how the implementation of it moving forward is important for state legislators to be both aware of and to help influence as it's implemented in your states. So one thing is important to remember about women is both their healthcare needs can be different. They live longer, they're more likely to be poor. They do use the healthcare system somewhat more in their younger years due to reproductive health needs, prenatal care, maternity care, family planning services, well-woman visits, as well as in later life where they suffer from more disability and more chronic conditions. So having that context and understanding about why women's health needs to be addressed across the lifespan viewpoint, and when you talk about health insurance reform and access to health care, it's important to keep all these things in mind. Part of the Affordable Care Act, there are a number of provisions in the bill focused on prevention and wellness, whether it's the coverage of preventive services without a copay or deductible, and that ranges from things like cholesterol screening to colonoscopies to pap smears to mammograms, and also with the additional women's health preventive services that were added in, coverage of things like domestic violence screening, contraceptive services and supplies, and counseling, as well as gestational diabetes, and very importantly, the at least one well-woman visit each year for women, and that will be covered without a copay or deductible, starting in new plans that were put in place after August 1st of this year, 2012. There are organizations, both national and local, that have been putting together information to help legislators and also the public and advocates to use when you need facts and factual information and ideas and strategies that others have considered and put together. So we're trying to bring all that together in one place from multiple organizations, sorted by topic, sorted by key question, sorted by organization, so that anyone looking for a one-stop shop of information on implementation of health reform would have a place to go to find good and solid information. That will be launched at www.womenandhealthreform.org, and we hope it's going to be really helpful to state legislatures as a key audience for this type of information.